Hello viewers, welcome to my channel Human Diseases and Tea. In this video, I will discuss about what Koyanagi-Harada disease. What Koyanagi-Harada disease, that is leakage disease, was first reported in the early 20th century by several different physicians who described its various manifestations independently. A Swiss ophthalmologist Alfred Vogt describes cases of a syndrome involving both the eyes and the integumentary system, that is of the skin and hair, particularly focusing on poliosis, that is whitening of eyelashes, and vitiligo in 1906. Japanese ophthalmologist Yoshio Koyanagi detailed in 1929 the ocular symptoms associated with the disease, including severe bilateral uveitis, which is inflammation of the middle layer of the eye and affecting vision. Another Japanese ophthalmologist, Inosuke Harada, provided description of the associated neurological symptoms such as headache, meningism, and sensorineural hearing loss in 1926. These early descriptions by Watt, Koyanagi, and Harada were later recognized as part of the same systemic condition, which is now known as Vogt-Koyanagi-Harada disease. Vogt-Koyanagi-Harada disease is a rare multisystem autoimmune disease that primarily affects melanocyte-containing tissues. Melanocytes are cells that produce melanin, the pigment responsible for coloring the skin, hair, and eyes. Leakage disease is characterized by a combination of ocular, neurological, auditory, and dermatological manifestations. The overall prevalence of leakage disease is estimated to be around 1 to 2 cases per 1 lakh individuals. Its prevalence is higher in certain regions. Leakage disease is more commonly reported in Asia, particularly in countries like Japan, China, and India. In some studies, leakage has been found to account for a significant proportion of uveitis cases in these regions, ranging from 20% to 40%. The prevalence of leakage disease is also notable in Latin American countries, where it may represent a substantial proportion of uveitis cases. In Europe and North America, leakage disease is less common but is still present. It tends to account for a smaller percentage of uveitis cases compared to regions with higher prevalence. Leakage disease progresses through 4 distinct phases. First one is prodromal phases, second one is uveitis phase, third one is convalescent phase, and fourth one is chronic recurrent phase. Leakage disease symptoms include ocular symptoms, neurological symptoms, dermatological symptoms, and these symptoms are caused by the immune system attacking melanocytes, the cells that produce pigment. Ocular manifestations are uveitis, choroiditis, cataract, glaucoma, and vision loss. The most prominent feature of leakage disease is severe bilateral uveitis and inflammation of the uveal tract of eye, which includes the iris, ciliary body, and choroid. The acute phase often begins with bilateral granulomatous anterior uveitis, which can progress to posterior uveitis or panuveitis, leading to retinal detachment and vision loss. Inflammation of the choroid layer of the eye can cause fluid accumulation under the retina, resulting in serious retinal detachment, which can cause blurred vision, floaters, and photophobia, that is sensitivity to light. In the chronic stage, inflammation can lead to complications such as cataract, glaucoma, and subretinal fibrosis, potentially causing permanent vision loss. Neurological and auditory manifestations are headache, meningitis, pleocytosis, and hearing loss, etc. VKS disease can cause symptoms of aseptic meningitis such as headache, neck stiffness, nausea, and vomiting. Meningeal involvement can also cause cerebrospinal fluid pleocytosis, that is, increased white blood cells in CSF. Patients may experience sensorineural hearing loss, tinnitus, that is, ringing in the ears, and vertigo due to inflammation affecting the inner ear. Other neurological symptoms may include photophobia, cranial nerve palsies, and altered consciousness. Dermatological manifestations are vitiligo, poliosis, and alopecia. Vitiligo involves depigmentation of the skin due to the loss of melanocytes, leading to white patches. Poliosis is whitening of hair, including eyebrows, eyelashes, and scalp hair. Some patients may develop hair loss, that is, alopecia. Symptoms include severe uveitis, etc. Vogt-Koyanagi-Harada disease is an autoimmune disease with a complex pathogenesis involving genetic, environmental, and immunological factors. Although VKH disease is not directly linked to a single specific gene in the way that some other genetic factors, what Koyanagi-Harada disease is associated with several genetic factors that influence immune system function and antigen presentation, particularly involving the HLA-DR4 allele. Although no single gene is solely responsible for VKH disease, genetic variations related to immune responses and melanocyte recognition contribute to an increased susceptibility to the condition. VKH disease diagnosis is based on the clinical diagnosis on a constellation of symptoms and findings, including ocular, neurological, and auditory signs, as well as cutaneous depigmentation or hair changes. Diagnostic tests like optical coherence tomography and fluorescein angiography help identify subretinal fluid and diffuse choroidal thickening in the acute stage. Lumbar puncture may reveal CSF pleocytosis and melanin-containing cells, aiding diagnosis, especially in the prodromal stage. The primary goal of treatment for VKH disease is to suppress inflammation, prevent complications, and preserve vision. VKH syndrome is treated with prompt high-dose systemic corticosteroid, high dose such as intravenous methylprednisolone followed by oral prednisone are the primary treatment and are crucial to initiate early to prevent chronic complications. Along with corticosteroids, other immunosuppressive drugs like mycophenolate, mofetil, azathioprine, or cyclosporine A are often used to improve outcomes and prevent recurrence of symptoms. In some severe cases or for those unresponsive to conventional treatment, biological agents like infliximab and adalimumab, which are TNF blockers, may be considered. While not a primary treatment for the disease itself, surgery can be necessary to address complications that develop over time, such as cataract and glaucoma. Prompt initiation of treatment is crucial to improve outcome and prevent the chronic sunset glow fundus stage of disease, which results in severe vision loss. Sunset glow fundus is a depigmentation of the choroid, the blood vessel layer beneath the retina, that results in a bright orange-red discoloration of the back of the eye seen during an eye examination. Regular monitoring is essential to assess treatment effectiveness and manage any potential recurrence or complication. This is all about Vogt-Koyanagi-Harada disease. Thanks for watching. If you found this video helpful and learned something new, please like this video and don't forget to subscribe for more health insights. Share this video with your friends and family members to spread awareness. If you have any queries, drop comment in comment box. Don't miss my next video. Until then, stay informed and take care of your health. Thank you. Thank you very much.